talk at the American Urologic Association on its international conference on men's health, and I put thinking outside the box, and the whole talk was about nutrition. And I put in a capsule, what is the most potent drug that you can take? I mean, the most potent drug, and I put these drugs, methotrexate, steroids, you know, these drugs that are really toxic. What's potentially the most toxic drug or the most potent drug? Without a doubt, no one got it. It's without a doubt food. Food is something we put in our mouths 24 hours, well, you know, every day for all our lives. They cause biochemical reactions. When I take 100 calories from a fat or 100 calories from a sugar or 100 calories from a protein, it's processed completely different. So you say, oh, I did well today. I only had 500 calories, but they're all from Skittles. You didn't do well. You didn't do well. Oh, doc, I only had 500 calories. Give me a high five. No. No, this is absolutely incorrect. So calorie is not a calorie. That's a big mistake. Calories are different. Our bodies speak via hormones, not in calories. Calories is a relatively new concept. Your dad didn't know what a calorie was, or your and they were in awesome shape because they ate real food, they were active, they didn't sit around on their screens all day.
They ate a lot more fat than we did.
Oh, and I believe saturated fat, by the way, will increase your HDL, which is your good cholesterol. So it and exercise are only two ways that you can increase your good protective cholesterol. Those are the only two ways, and I'm a big believer. I think fat's very good. I got all my family, they love fat, even like animal fat. And it does increase your HDL. But the issue is our parents, they were not on a screen, on a laptop, 1, 2 in the morning with that blue light affecting their sleep, stressed out with all these demands, got 18 devices around your belt. Your pants can barely stay up because you have so many devices and they're ringing everywhere. Seriously, I mean, something's clicking here, something's ringing there, and now they just keep adding more devices. You know, the watch, and then there's the Fitbit. I mean, those are all okay. I mean, it's fine. Just get up and move. Walk for an hour a day, half an hour a day. Just get up. You know, eat real food. That's a concept. Turn off your screens. No more than an hour or two a day. It's a concept. But the problem is, it isn't getting any easier, and our kids are only getting worse. It's going to be interesting. It's the great experiment. How are our kids going to turn out when they're being babysat by an iPad, or you know, the games and things like that. You know, the average gamer in America. You know how old the average gamer is in America who plays games consistently? You never guess. How old do you think the average?
5 years old.
How old?
5 years old.
5? Who said 38? You're a smart guy. 30. It's exactly right. It's just 1 year ahead of me. I don't play games. I just never got into it. I was a sports guy.
Tons of nieces and nephews.
38 years old is the average age. 38. They go and they buy the PlayStation and the Nintendo. Not Nintendo. The Xbox. Thank you. I'm kind of a little bit outdated. I need to get dated because when I talk and my children don't, I'm constantly on Nintendo. They look at me like Sega and all that. That was my day. Sega but the Xbox and the PlayStation, these things are, they go and buy them and they play them. They go to work and they come home and play. Or some don't even go to work. That's a whole other story. You know, men these days, this is way off topic, but men these days, we've got to step it up, you know, to playing a lot of games. Go ahead.
So to bring it back around to the nutrition topic, I have a question.
Sure.
Which dietary supplements help with prostate cancer during, post?
To be completely honest, there are a lot of supplements. There are no good studies that I'm going to be able to pull out and say this. We looked at, for example, the SELECT study. There was a study that looked at lycopene and selenium. We thought those things were helpful for prostate. We've actually found out they do nothing. There was actually a study that showed that they actually are no better than a placebo. And there is some studies that say selenium may even be harmful to prostate cancer, which we thought was good.